just to review what was discussed earlier today, we know that there's different types of dry eye. So patients can have a deficiency in the amount of tear they produce, and that's called aqueous-deficient dry eye. Patients can have a deficiency in the lipid secretion from the lid margins, so they can have a lipid-deficient dry eye. Patients may have smaller amounts of what's called mucin, and that's the third portion of the tear. It's the lowest portion of the tear that actually rests on the surface of the eye, and it's responsible for helping spread the tears over the eye, as well as provide a defense mechanism against the irritation. And in fact, you can have a combination of any one of those three as well and be diagnosed with dry eye. Neural loop-associated dry eye, we were just talking about how the sensitivity of the eye can play a significant role. So we do see that decreased sensitivity results in dry eye. And then, as we discussed, environmentally induced dry eye. So you can see that there's many different types and causes of dry eye. And what does that mean to us and the patients? Well, different causes means that there are different treatments. There are many, many therapeutic approaches to treating dry eye. And we see that there's these three major categories or three buckets that we call aqueous, mucin, and lipid-deficient dry eye patients. And when we develop our therapies and test them, we are targeting each one of these buckets for the development of the next generation dry eye product. And we do believe that in the future, it's going to be what we call a polypharmacy. So if I'm a dry eye patient and I'm a aqueous-deficient dry eye patient, but I also have a lipid issue and may have some environmentally induced dry eye as well, I may actually take 3 different therapies. Or there may be one therapy that is a combination of a few different active ingredients. So that's what we see the long-term future to be. First, let's get another option onto the market, but then eventually when we have many options, we see it as a polypharmacy.